Hello, everyone, and welcome back to the medical equipment world and healthcare. Get the scoop, the podcast where we break down durable medical equipment, patient care, and real world solutions for caregivers, families, and healthcare professionals. I am your host today, Tara, your certified medical equipment specialist and founder of CFS Medical Supplies and Equipment, CFS Solutions. And my co host is not here today, that would be Silas. But we're going to carry on. So, whether you're new to the DME world or a seasoned provider, this show is here to give you insight, tools, and stories that matter. So, I'm going to read a disclaimer right now just so that we can go ahead and get into this wonderful conversation I'm about to have with Miss Diane Carbo. She's a registered nurse and with a slew of information and 50 years of clinical and community information. So, this disclaimer says the information shared in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical decisions or concerns. Neither the host nor guests assume liability for actions taken based on content discussed in this or any episode. So, today, welcome Miss Diane Carbo. Hi, Miss Carbo.
Hey, Tara, thanks for having me. I'm excited to have a conversation about durable medical equipment. As I told you when we first met, I'm an old RN and old rehab nurse, as in seasoned.
I know.
Everybody hears that old, no, I'm seasoned.
We love to use the word season. So I'm going to read your bio here. I love it. It says Diane Carbo is a registered nurse, is the founder of Caregiver Relief and creator of the My Vital Vault, an innovative personal health and life planning system designed to help families stay prepared for both everyday caregiving and life's unexpected emergencies. I love it. A registered nurse with over 50 years of clinical and community-based experience, Diane has dedicated her life to helping aging adults remain independent at home and empowering family caregivers with the tools, education, and support they need to succeed. Her passion is deeply personal. Diane began her caregiver journey as a teenager caring for her mother while still in high school. Decades later, she would again become a caregiver for her father, mother-in-law, and her oldest son, a disabled veteran living with severe chronic pain condition. These experiences gave her unique insight into the challenges and emotional toll that caregiving can bring, as well as the deep meaning and connection it offers. Today, through Caregiver Relief and My Vital Vault, Diane helps families plan ahead, manage crisis situations, and navigate the complexities of long-term care, especially for loved ones living with dementia. Diane's mission is to ensure that caregivers never feel alone and that every care journey is met with compassion, dignity, and resilience. Oh my gosh, Diane. Wow. Wow.
Tara.
Sometimes when I read people's bio and I it is so it gives you you like paused, right? Like wow. And so yeah, caregiving and healthcare, it's so interesting and I'm glad we're able to have this conversation today because when you talk about healthcare and I say it's an ecosystem because it ties into everything, right? Dealing with healthcare,
Yes.
caregiving,
Yes.
healthcare, medical equipment, all these things are so important. And so, Diane, I want to thank you for participating today on the medical equipment world and healthcare. Get the scoop.
Well,
So,
thank you for having me. I'm real excited to be here.
okay, and we're glad to have you. We are so glad to have you. So we'll just jump right on in. So Diane, I read your bio. So give us a little drop back here about Diane and your journey in healthcare and what inspired you to become a nurse.
Well, I'm the oldest of four, the alpha female in the family. And as
Okay.
and as I growing up, I honestly thought I would be a teacher. But
Mhm.
as a very young teenager,
Uh-huh.
I helped care for my grandmother, helped my mom care for my grandmother with a broken hip. And
Mm.
then I decided, oh, I want to check into healthcare. So I worked as a candy striper and volunteered at the local community hospital.
Uh-huh.
And it was there I saw the impact nurses had on their patients.
Mhm.
And then, as a junior and senior in high school, I became my mom's caregiver as she battled lung cancer.
Oh, wow.
So I found at that time that not only could I be a nurse, but I could also be able to teach my patients about their conditions, their diets, their
Mhm.
medications, and stuff. So, um, and while I was caring for my mom, it was brutal. There are millions of young people caring for a parent or a grandparent, and I know the trauma and the hopelessness they feel. So I felt like I needed to go into nursing to help others.
Wow. Yeah, that is definitely, yeah, caregiving is I mean, it comes in different aspects, I think, and yeah, so kudos to you for that. Yeah. So
Thank
how did
you.
you evolve into dementia care and care management?
Well, when I first got out of school, I got into orthopedics.
Hmm.
And because, and as I said, my first husband was transferred often. So rehab nursing, you could work with head injuries and strokes, and
Uh-huh.
that's where I saw the brain damage impacts person's personality and behavior. So when we moved to another city I was living in, I worked in senior behavioral health, and that's where I learned more about dementia. My grandmother developed dementia in her 90s, which is common for people over the age of 90. It does happen.
Mhm.
Anyway, it was at this time that I also started working for private review organizations that were hiring nurses to health cut care, healthcare costs. Say that again.
Uh-huh.
It was at this time I worked for one of the very first private review companies, and they were hiring nurses to help cut healthcare costs.
Uh-huh.
So I've had varied experience in different areas of nursing, and what I found was I was really good at catastrophic care management.
Oh, wow. Wow, that's
Um,
interesting.
yeah. So when I actually when I was doing hands-on nursing, I was in doing hospice, and I was in a car accident, and that's when I decided I'd start my own website and help seniors and their caregivers maneuver the medical delivery system because I couldn't do the hands-on um, as good. Now, I tell people I used to pick up men for a living. And they really did, because in rehab you're picking up people all the time, and it just ruined my back and my body. But I came to learn about dementia and how the brain works, working with head injury, stroke victims,
Hmm.
having helped with people with alcohol dementia. You just know, you start to learn the parts of the brain and the impact it has when those brain cells die off. So it's a fine niche, and that's one that I love. I have a special place in my heart for those suffering from dementia.
Wow, that's interesting. When you just mentioned about different alcohol and alt and dementia and all that. So, because I wasn't familiar, I wasn't aware of that. So basically, what you're saying is, so you have some type of condition if you were drinking quite often or doing things like that, you could cause dementia. Is that what you're saying?
Oh, my Lord, yes. There are over 200 types of dementia.
Mm. Wow.
And dementia is an umbrella term for many other diseases.
Uh-huh.
You have the Alzheimer's, you have Lewy body, which is the second most common type of dementia, but it's also the most misdiagnosed. You
Mhm.
have vascular dementia due to strokes. You even have reversible types of dementia if you catch them early, like B12 deficiency can cause dementia-like symptoms. And there are other conditions, but even a person who's a heavy drinker, if they stop drinking before they kill all their brain cells, that's a terrible way to put it, but it's the truth, they can reverse or at least stay the same and not deteriorate.
Wow, that is very interesting. Well, I wasn't aware. So I
Yeah,
guess we learn
well,
something new every day, right?
Yeah, well, you know what? I will tell you that there's two things that also are contributing to dementia right now. They're saying diabetes is the third contributing cause of dementia. And it's called the third type of dementia at this point. They're still doing research, but when your sugars go off the wall and stuff all the time,
Mm-hmm.
and it can cause dementia. So you really want to take care of your life, your blood sugars early. Then the other one is people that are hard of hearing.
Uh-huh.
And, I can tell you right now, one of the things that people hate to do is um, they hate to wear hearing aids because it makes them look old. And I get that all the time. And nowadays they're not bad at all. They're not big and you can hide them. But what people don't understand is when they don't hear part of their different sounds and stuff, they are losing part of their brain.
Mm.
So it will just become it'll shrink. The brain will shrink because the information is not getting to that part of the brain. So you do develop a form of dementia. So, and I'm very frank with my clients when I work with them and say, put that daggone thing in. You got to hear. And I
Right.
know, men will say, well, I don't want to hear the wife crabbing at me.
Uh-huh. Uh-huh.
You know what? It's really bad. You need to hear those voices. You need to hear those noises to keep your brain functioning at a good level.
Wow, that's interesting. Yeah. Oh my goodness. That's why I love these. That's why I love having these conversations because literally every time I do this, I learn something. Oh,
Yes,
I
yes.
do. So, what is one common myth about dementia you want to debunk?
Oh, I've got like 100 of them. So you'll have to tell me when to stop.
I'll
But
tell you what
I think the very first one is people think that dementia is a normal part of aging, and it is not.
Mm.
It is not. Well, while the risk increases with age, it's
Uh-huh.
not an inevitable part of growing older. Many older adults never develop dementia. So it's caused by different brain diseases like Alzheimer's, but it's not aging itself.
Huh.
And the other thing is people think dementia is about losing your memory loss. Well, memory loss is only one symptom, but dementia affects many areas: problem solving, communication, mood and behavior, your
Yeah.
movement, your judgment, your sensory processing. It's a whole brain condition.
Mm.
One of the things I tell my clients that have family members with dementia: choose your battles wisely, because their the reasoning part of their brain is
Uh-huh.
broken.
Uh-huh.
So it doesn't make sense to argue with them because you're not going to win. They have no ability to understand. Um, the other thing I want is people think, oh, nothing can be done. There's no hope once you get the diagnosis.
Mhm.
While dementia is progressive, much can be done to improve the quality of life. There's medications to manage symptoms, activities to promote engagement. If you have supportive environments, there's behavioral approaches you can take.
Right.
You put things in advanced planning, put some things in place so you know what your loved one wants and where they're going till the end of their life. And early intervention helps both the person living with dementia and their caregivers.
Yeah. You know what? My grandmother had dementia and she had cancer too, but it was interesting because right before, I probably was maybe a few months before she passed,
Mm-hmm.
um I remember my son being there. We were in at my hometown and he was outside playing and she said, "That little boy is having himself a good time." And I looked at her and I was doing her hair and it's like she didn't know. It's like she knew me, but she didn't know me.
Yes, yes, yes.
And
Common.
she knew she knew my son, but at that moment in time when she looked at him, it was like a little strange kid in her
Yes,
yard.
yes,
And
yes,
that just did something to me. And it is so heartbreaking
yes,
to be with your loved one and and to have all these memories, right? And then all of a sudden it's a whole different life. Like they're
yes.
there, but they're not there, you know.
That's why they call dementia the long goodbye. because that kind of interaction that you had with your grandma at the time,
Mm-hmm.
you saw her flicker a moment of forgetting who she was and all of those things, who you are, not who she was, but who you are and who your son was. And then you have moments of those, of her, the light comes on behind the eyes, and you say, oh my God, there's a connection there. And that is what keeps people hopeful that they're going to get over it and be better. And they don't.
Right, right, right. And you know what? I always often because people, it's like a mix up between Alzheimer's and dementia.
Yes. Well, dementia is the term for many brain disorders.
Mm-hmm.
There's Alzheimer's, Lewy body, vascular. There's Pick's disease. There's early onset dementia. There's many. Like I said, there's over 200 types of dementia. So through testing, they can determine what type of dementia. And again, Lewy body is the most difficult to diagnose. It's the most misdiagnosed because it has many mental health symptoms and behaviors
Mm-hmm.
that they think it's a mental health issue instead of Lewy body.
Yeah, it is really interesting because I know of a lady and she hasn't been diagnosed with either, right? Dementia or Alzheimer's or anything like that. But it seems like some of her actions sometimes make me wonder if she has a touch of dementia. It's kind
Well,
of interesting.
dementia can start as early as 20 years before a diagnosis comes.
Wow.
And what I tell people, like if that was your grandmother, I'd be saying to you, Tara, get her in, get a cognitive test done.
Uh-huh.
Uh, I prefer the SLUMS test, the St. Louis University mental status exam, because it picks up on the earliest um, earliest signs of dementia, whereas the standardized test that every doctor uses when they think about it is the mini mental status exam, the mini mental status exam. And that you have to have a baseline. So
Mhm.
you have to have at least, everybody, I believe, at the age of 50 should start having a baseline done and do it every year. And then if there are any changes, and I can tell you in all honesty, there are some really brilliant people out there. Sorry about that.
Oh no, you're good. You're good.
Okay, okay. There are some brilliant people out there that are really good at hiding their dementia from others, and their family members see how they're not connecting the dots all the time in their everyday life, and that they can even hide their they can take a test and still pass it, the mini mental, and that's why family members get so frustrated at that test. So I really prefer to ask, and I tell you, I encourage everybody that's listening, if you're going to get tested, you can go online and check out the St. Louis University mental status exam. But it has to be done by a professional to be tested, to be, graded and the results given to you. But I think that's the best one that I feel is really important for families to take care of for the testing.
Wow, what a great, wow, gosh, what some great information, Diane. That is interesting. So
Thank
the
you.
St. Louis mini test. So
The
that is
St. Louis, it's called slums. Just think
long.
of slums. Yep, you're in the slums. St. Louis, yeah,
Okay.
university mental status.
Oh my gosh. And so that test, is that something that you can just ask your doctor year annually, like if you're doing a physical, or you have to have some type of
Well,
um
yeah, you can ask your doctor, but you can actually download the test. You can find it online and
oh,
download it.
uh-huh.
And you might want to, if you're a family member and you think somebody has dementia, uh, you can have fun with it and test them and see what the results are, and then take them to somebody needs to review them professionally. But,
Right.
you know, it, it's hard to get into a specialist nowadays. It's hard, but I can tell you the earlier you diagnose the disease, whatever it is, whatever type of dementia it is,
Right.
the sooner you can take action to have a better quality of life.
Yeah.
Early intervention and early diagnosis can make things so much better for the caregiver and the family member to have a better quality of life for a longer period of time.
Wow, and that was my next question. What role do caregivers play and what are they often missing
Yeah.
in this?
Well, and it's really hard. Yes. And I think the early diagnosis one, everybody, I will tell you, one of the things I've learned in my 72 years on this life is denial is a very strong coping mechanism.
Mm,
And people don't want see things they don't want to see. So, and that's really hard. So, they don't take them until something happens, terrible happens, like there's car accidents or they start falling or they're the long distance or working caregiver that comes home and finds mail everywhere or things hidden in different places that shouldn't be, then they know. But I
mm,
think one of the things caregivers need to learn is to translate the needs and emotions of a person with dementia when language or behavior becomes confusing. Because they're the primary advocate in a healthcare setting, and caregivers don't understand that one of the things that a person loses is they a slowed process of understanding what you're saying.
mhm.
Depending on the type of where the brain is effective, they may lose their ability to communicate. They may lose their ability to understand what you're saying. So I tell every caregiver, when you're dealing with somebody with dementia, the most important things to do are, number one, speak slowly,
Mhm.
make eye contact, and only give one or two word choices, like go this or this, and let them point if they're able to make a decision, or do you want coffee or tea, not three things.
Mm,
And the other thing you have to remember is, if they're not understanding what you're saying,
mhm.
and this is hard for caregivers to accept, please be aware that how you say it is so important. And it's really hard because they'll pick up on your stress, your anger, your anxiety. And Lord knows every caregiver out there has that. So I recommend that people take a deep breath and smile as hard as it is and say what you need to say, carefully and slowly, and not with anger, because that's what they pick up on the most.
Wow. Wow, that's great information, Diane. Wow. Watch how you approach it. Watch with the words that you say. That's important. That's good.
Yeah. And you also have to be aware of the environment.
Yeah.
They a person with dementia, they don't see things in the world like we do. Like if you put a black rug down on the floor, they might see that as a hole and they'll walk around it. It's a great tactic to use if you have somebody who's wandering. You put a black rug in front of the door. They may not go near the door. You don't know, because until you try. But
Right, right, right.
yeah, it's they don't see the world the way we see it, and they're, like I said, they lose their reasoning
Mhm.
abilities. So you have to, be patient and
Yeah.
kind, and it's so hard.
Yes, that's so critical. That is so, so critical, to be kind and nice and just be patient with them, because you don't know. I know we get families sometimes they're like they're at their wits' ends, of trying to figure it out, the equipment, what do you get? Like, oh my gosh, and it's just and I always tell them, like, unfortunately, you have to have patience. One thing you have got to have is patience.
Yes.
It's
The
not.
other thing I want to tell caregivers, and they argue with me about this, I'm sorry, but they need to focus on their own well-being. I will tell you right now, many caregivers neglect their own physical and mental health
Yeah.
They suffer from chronic stress, burnout, isolation, and depression are common. In fact, what's really sincerely scary to me, Tara, is that 63% of family caregivers become seriously ill from the chronic stress or die before the person they care for
Yeah.
passes.
Yeah. That's so true. That is so
It
true.
really is. It is. It is. So that's what caregivers have to. I encourage them to. I have a concept. It's called a care team partner approach,
Hmm.
and I am encouraging caregivers because they feel if they're as if they're a failure if they ask for help, and they don't want to accept help from everybody because then they see that as a failure or a weakness in them. And I'm saying that is, oh no,
Not
you
true.
take everything you help you
I
can.
agree.
And, so I have a care team partner approach where I ask people to contact their friends and family because every caregiving situation has usually one person that does the main care.
Hmm.
There's many uninvolved siblings and judgmental extended family members
Oh my
that will
gosh.
give the primary caregiver such grief. It's just terrible.
It is. Oh my God. That, and we hear so much of that because
Yes,
we get
yes,
families that come in and they're like, I am trying to make a decision for my loved one. And this, it'd be their siblings, like they're not here. They're telling me what I can get, what I can't get.
yes,
Oh my
yes,
gosh. I mean, we get it's so funny because we're at that point where when they've tried a lot of different things. And now
hmm,
they're like, I need someone to give me some type of equipment, something, whatever it is, to help me figure this thing out, right?
yes,
Whether
yes,
that's helping with a better type of bed option that helps lift them, help them not so much having to lift the patient because that equipment can help do a lot of that.
yes,
Whether it's incontinence and they're constantly changing their loved ones and they don't know that there's other better quality of items out there and other things out there, they kind of help you where you're not having to do all those things so much. Any little bit of anything that you can get to help you to eliminate you having to be constantly wearing yourself out is huge. But it's so
yes.
funny you say that because we hear it at that point, like, oh my God, I'm the only one here. I'm the only one doing this. I have we have people, they even fly in to help their loved one, and you have a sibling that's right here in the same city with mom or dad, and
Uh-huh.
they're not showing up. But then I tell them, you know, I get it. I know you're upset about that because you feel like you're the only one who's trying to help your loved one. But then you got to remember sometimes everyone doesn't have the capacity.
But here's the difference between you and me when I say that. I say they may have not to have the capacity
Uh-huh.
to do the hands-on care,
Right?
but pardon me, but damn it, they can contribute to
Yeah. Yes.
somebody coming in and helping
Yes.
or
Yeah,
paying for equipment. I don't care.
exactly.
If you're not going to do your fair share, you need to contribute in some way.
Exactly. Now we are both in agreement with that part because that's the next thing. So if you can't, if you can ask that person to like if you can, I know you can't be here so everybody doesn't have the capacity to do it, but like you said, chip in some kind of way whether whatever that is. Even if you have to do some of the phone calls for the loved one, for the caregiver, because the caregiver's done so much. They're doing so much. So if you can just make some phone calls and find out some resources or
Exactly.
anything could be a big help to someone versus leaving them.
Make a meal, do some laundry,
Yes.
take pay for the vet to be take the dog to the vet to be
Yes.
groomed, whatever.
Yes.
I have a family meeting manual I will send you to share with you because I
Okay.
encourage people to hold a family meeting, even if it's on Facebook or Zoom or whatever, so you can read
Right.
it. And everybody has a say. I have a special technique that people use. I don't want anybody saying anything negative. There's all these rules, but if that at a family meeting, I recommend that people and not just family, but extended family members, if they're going to be involved in any way,
Hmm.
I insist that they try this technique and get people to assign jobs, like you were saying. Hey, you can't do this, but you can help me by doing this. Make these phone calls, or can't you be the person to take care of the medications? Make sure they're reordered. Make sure they're put in the right medication delivery system. Can you do that? Or
Right.
somebody's good at activities. How about planning activities for our loved one? He's it's coming up to the holidays. How
Hmm.
do we have holidays and not get him stressed? Well, you do holidays different. Maybe it's just a few hours several times during the week where people come in small spurts, small family members versus everybody together.
Hmm.
There's so many things that you
Right.
can do.
Exactly.
Yeah.
Exactly. And so in our next conversation, we're going to talk about adaptive equipment and DME. So you being a nurse, and what is your perspective, and how does DME change outcomes for dementia and rehab patients?
Oh
Since
my God, this is my favorite topic.
tell me, so I can chime in.
Well, from my perspective as a rehab nurse with over
Okay.
50 years of experience, I can
Okay.
tell you these
Uh-huh.
are life-changing tools for
Mhm.
both patients and caregivers.
Right.
First, they promote safety. They prevent falls with grab bars and shower chairs and bed rails. They
Mhm.
reduce the risk of injury for caregivers with proper lifts and
Yeah.
belts and transfer boards. They
Mhm.
provide stability for mobility. Oh, it's just. And here's my favorite one is they actually support independence and dignity.
Yes.
One of the things I have to tell you, Tara, is I encourage family members to learn patience, but also be lazy. Now that sounds crazy, but you have to sit and allow your loved one to do as much as they can for themselves for as
Yep.
long as possible.
Exactly.
And what I like is about adaptive utensils
Hmm.
or dressing aids or toileting equipment can
Yeah.
help a person maintain their personal dignity,
Huh?
and it encourages them to continue to take care of themselves because you want to encourage independence, not dependence on you.
Exactly. That is it. Perfectly answered, Diane. I love it. I
I
love
feel like
it.
I'm in
Yes.
school. Oh no.
Yes. You know, it's so interesting because that's one of the things that we it's so funny because we have clients where they'll, because people don't really know. So they'll go online, and unfortunately they order products that does is not conducive to the patient and what
Yes.
they have going on,
Yes.
if that makes sense. And so unfortunately it's the
Listen, they see something. This is a big problem with me is,
uh-huh.
they want the cheapest. Well,
Oh my God.
I'm sorry. I'm sorry. It cheapest doesn't mean that it's the right one or it's going to last. You have to think about future care needs as well.
Oh my
Um,
God, Diane. Oh my God. Like we preach this to the ceiling. Literally, this is one of our pet peeves, one of mine, especially because being just in this for so long and seeing how it is just so you talk about cheap.
yes.
Unfortunately, people go online, they see the cheapest thing and they want to purchase it, and they find out that it doesn't work for them.
Yep.
It's the
Yep.
wrong thing. It's not appropriate because it's gonna, it could be a safety issue as far as what you're supposed to use and what you shouldn't be using. And
Yep.
so what we've been doing is we're trying to tell and educate people as much as we can about that's why we created CFS Solutions, because we're in the DME side, but on the solution part of it is consulting and coaching families, right?
Yes.
So what
Yes.
we do is we have a full on, we even do virtual, and you could be in another state. It doesn't matter where you are, where we actually do virtual consultations with families and all the caregivers. And this is one of my requirements that I tell families. If you want to purchase an example, we have some families, they say, hey, I see this bed, this rotation bed, and I want to purchase it. Well, let's hold up for a second, because we see it and it looks amazing, but it might not be for your loved one, depending on what they
Yes.
have going on. So don't just go online and just start purchasing these products or any other product. you want to have a consultation with someone who knows this industry, who can
Yes.
say, okay, Miss Jane, you have what, ask the family, what's going on with your loved one? What are they using right now? What does the house look like? What is, all these different things we ask in an assessment, and then we show them how to use it, or we go through, we ask questions and all those things. You don't get that when you just go online blindly ordering these products. And I tell people these products is like it's like some of them are like getting a vehicle. It's machinery. It's
Yes.
machine.
Yes.
You need to know how, and not only that, after you purchase it, sometimes you don't even know how to use it. You want to be
Yes.
able to, go to your local, we say go to your local provider. And of course, if you feel like they're not helping you where you need to, we do them all over. It doesn't matter where you are. We do virtual consultations and virtual assistance to families because it is truly a need and you don't know it until you're in it.
Yes. And Tara, I will tell you, and after 50 some years of nursing, I'm going to tell you, doctors and the typical nurse knows nothing about durable medical equipment. Now,
Yeah.
rehab nurses, that's another story.
Right. Right.
And there aren't many of us out there.
Mhm.
So, and so when you're getting the script from the doctor for something, he doesn't even know what he's ordering. He just,
Yeah.
I mean, I can say that because I know, but they need someone like you who is a specialist. The other thing I think that the equipment does is it reduces physical and emotional strain for caregivers.
Yes.
The
Oh.
mechanical lifts can prevent caregiver back injuries. You
Oh.
know, like I said, I used to pick up men for a living, and it was hard. And I did learn that with proper seating or
Yes.
positioning devices,
Mhm.
it reduces the need for constant repositioning, and that's so important.
It is no, and down to just the right bed, the right
Yeah.
walker, the right
Yes.
lift. It
Yeah.
is so important. And those things that we have seen it, like we have had families, I give you an example, we'll talk about incontinence here and how families continue, a patient constantly gets UTIs. Well, they're getting UTIs a lot of times because they don't have the proper incontinence. Some of the
Yep.
cheaper
Yep.
brands, they it's causes to be soiled and you're sitting there in it, right,
Yes. Yes.
unfortunately. And
Yes.
so where you get some other products out there that's better quality, but a lot of times people don't know about the better quality ones that they can use where you're not, that urine it's not sitting on, that you're not being soiled because it goes into gel and it's dry, and now you don't have to
Yep.
get these UTIs. And it's so many different things and layers out there that can be a blessing to people if they just knew.
Well, I just had a caregiver contact me and say, my I called him a heavy wetter. She says he's a big drinker. I said that makes him a heavy wetter. And
Uh-huh.
she was saying that every night he wets the bed and she's double diapering him. And I went, ah,
Yeah.
it doesn't work like that. Two diapers on doesn't mean it's
Yeah.
not, it doesn't work. And I did the same thing. I said to her, you need better quality of products. There's so many things that you're not doing. I even told her she could, and I don't know how often you get these orders, but I really think it's important that they you maybe can use a condom cath, a Texas catheter.
Uh-huh. Uh-huh. We've had
So,
people do those as well. And but
yeah,
a lot of times the product itself is the problem. So I tell people they have some of the products out there that sometimes the insurance covers, but unfortunately some of those that they don't sustain. They're not keeping up with the output. And so
yeah.
I tell them, I says, you can use those, but there's other products out there where you can actually just put an insert, a shape pad, what we call it, inside of those that the insurance are paying for and still get the same
That's the
resolution.
information I gave her as well.
Right. So and that quality of for those are so good that you just see the difference. But again, it goes back to being able to talk to someone so they could tell you to share that
Exactly.
information with you. And I'm so glad that you do that, Diane, because that is
Oh,
huge.
well, it's because I know. But
Yes.
people don't understand that adaptive devices can enable participation in hobbies like
Mhm.
adaptive gardening tools or
Yes.
accessible controls or
Mhm.
communication devices or mobility aids or just low vision equipment is
Yes.
so important.
Mm.
Bottom line for me, the right equipment at the right time just empowers the person receiving care and helps sustain the caregiver. It transforms. I can't. When I think of Sister Stephen, my French teacher said, "You're an American, not an American." But it does.
That's funny.
It transforms I can't into I can
Right.
with support. And that's what
Exactly.
I love about durable medical equipment and assistive devices.
Yes. Oh my gosh, that's so good. So good. Wow. Well, Diane, I am so excited about this. This is some great conversation here. So I'm just going to remind people there on the medical equipment world and Healthcare Get the Scoop podcast. And we're talking to this wonderful Diane Carbo. She's a registered nurse and all of the above caregiver relief and with the My Vital Vault. And so I am just so excited to just be here and letting people hear this great information because I know it's going to be a benefit and a blessing to people out there listening, Diane. And
Thank
so
you.
with that, we're going to just keep moving on. So, what tips for home health nurses or families managing multiple diagnoses would you give them, Diane, today?
I think that the hold on here. Let me think for a minute.
Oh, you're good. You're good. You're
The
good.
dogs are I
Oh,
had to look.
that's right. Your dog's sitting right now. That's what's so awesome about podcasts. We can be doing so many different things at one time, right?
No, I know.
To
So
just
I'm
talk.
sorry here, but um, one of the things is the right equipment used correctly can mean the difference between thriving at home or a
Mhm.
rapid decline towards institutional care.
Yes.
So I think that oh, it just went out of my head. Ask me again.
That's oh no, you're good. You know what? We can keep moving on. There's hey look, nothing here. We were just asking about the home health nurses, our families with
Well, home
multiple diagnoses. That's all.
actually are dropping the ball. And I'll tell you why. It has to do with reimbursement.
Mhm.
And a lot of times, the insurance companies are the doctors are sending patients home with
Mhm.
home care, but it's for physical therapy or occupational therapy, and they're not sending the nurse out. And I've seen a lot of things happen recently because of this situation. So I want to tell home care nurses that because I've done home care, I get it, I know it,
Mhm.
that they have to be able to look at the whole chart. I had a home care agent nurse come into a home recently because I called the agency up and said this patient's got a history of urinary tract infections and is on new seizure medications, and all they ordered was PT and OT and no equipment's here. I
Right.
said, nope, 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 that's unacceptable. And I really encourage every single family
Mhm.
to encourage having a home care nurse come to the house because there's so many things that they miss in the hospital.
Mhm.
You need to learn about your medications. You need to learn about safer mobility. You want independence and dignity, and you just want to have support, and that you don't get education. We're not educating our people in any stage of life anymore. When they're in the hospital, there's no time for it. Not in and the ER are no longer sending patients home with home care, which is really sad in itself. So I encourage every home care nurse to take your time and listen to what the patients are telling you and get in there and review things because we're dropping the ball on all aspects of care in the hospital. We're not allowing for continuing continuity of care, and it's really sad. It's a time where the home care nurses should be able to educate patients about things and suggest things. They should be able to suggest, hey, you need this or you need that. And they don't know
Yeah.
what, a lot of the equipment that they can get.
Right, right. Because I think sometimes everyone's so focused on your basic front wheel walker, your basic cane, your basic
Yes.
bed, your basic, all there is just basic stuff, right? But there's so
Yes.
many other things out there. You have easy lifts. I like those over some of the Hoyer sometimes, just depending on the patient's condition, of course, and what's going on with the
Uh-huh.
patient. But there's so many different things out there to help families. You got your different type of long-term care beds that just literally make patients' lives, so the caregivers and the patient can relax a little bit more. They're feeling independent somewhat,
Yep.
right? And then
Yep.
you have the caregiver. It's so interesting. We have a couple of facilities that'll call us up and be like, hey, we have a patient who's a fall risk, and the family just is at their wits' ends because what they're doing is they're in a facility, but yet the patient is still falling and the family is getting the call. So
Yes.
there's beds out there that go low enough to the ground that when your loved one tries to get up out the bed or roll over, they're not hitting the ground. So it avoids them breaking anything, or it avoids a fall. So you have that
Yeah.
fall mat there, but you do have,
Exactly.
right.
Tara,
Hmm.
I was at Sister Candy Institute, we had floor beds
Hmm.
because you have stages of recovery through
Yes.
a head injury where there's an
Hmm.
agitation stage. And that, and it's so funny that you would talk about the bed so low because I recommend that when
Hmm.
you have fall risks like that. And you will not believe the frustration and the things that are said to me from the staff that I say this to, hey, this is not that hard.
It's
Put the mattress on the floor. There are low beds.
it,
Yeah,
it is, but a lot of people don't know. In
yes.
these
And you know what? It
facilities,
just
they don't know.
makes exactly. And you know what? It just makes common sense because they're not going to break a hip or have a head injury and do harm to themselves if they roll
Exactly.
off. And you know what? The other thing I'm learning right now is the nursing homes, they have alarm fatigue. They can put an alarm on somebody to get when they get out of bed or out of a chair, and that person's already on the floor, and probably the alarm's been ringing for 15 minutes because they're busy doing other things. So I say, put them on a low bed.
Yes. Oh my God. Exactly. Put them on a little bed and put that fall mat right next to it, and now you don't have to
Yep,
worry about it because you have to report every time they fall. And
exactly.
we had a scenario where the family had their loved one in one facility, and they were calling the family over and over again. This said facility, oh,
Oh,
your loved one's falling again and again. They were like, well, what in the world? Like, what do you suggest? And they had no suggestion for them. So they took them out and put them in another a facility that does know what to do
yes,
and got what they needed. And even though the family has to come out of pocket to pay for it and things of that nature, but they're not getting any more calls. And
yes,
they're like, oh my God. And they're not only that, they're saving their loved one from having to go back into a hospital because they then broke their hips or fractured something or
exactly.
hit their head. Or I mean, there's so many different things that you have to look at. And so, and I tell families too, I say if you have your loved one in a facility and they're not offering innovative things or giving you resources and how to navigate things, then you may need to put them somewhere else because
A 100%
yes,
correct.
yes,
Yeah,
literally, yeah. And
exactly.
so, and just empowering because unfortunately, the costs for assistant living in some of these places sometimes people just can't afford it. So I tell families like you have got to really equip yourself to know how to navigate inside the home and what's needed in the home so that you can be a benefit to yourself as well as your loved one.
I tell people, and people find this very offensive, but I say it anyway.
Mhm.
The assisted living facilities are the most dangerous of all of our medical delivery systems. And people go, "Oh, how could you say that?" Well, let me tell you, I've been an assisted living administrator. I was a DON for a director of nursing in a very posh assisted living. And
Mhm.
I can tell you that they are based on a social model, not a medical model. And that's why I have a hard time with people in assisted living and memory care, because you're supposed to, according to a social model, be able to tell people what you want and when you want it and how you want it. You'll be able to express your desires and wishes. People with dementia are unable to do that.
Mm.
And it's all assisted living is high cost senior living because they have nobody on staff. They may have an RN on staff or an LPN on staff, but it's not required. The staffing is very poor. You have to have they have an a la carte menu. So if you want somebody to check your blood sugars or blood pressure or whatever, you have to pay extra for that. And it unless you're there on top of your family member all the time, things will get missed because they're not medical professionals taking care of your loved one.
Wow. That was interesting. That was woof. That was a word right there, Miss Diane. I
Well,
mean, because that's yeah, that is yeah, that wow. So
I
you so
can tell you horror stories, and it just makes me sad. I've gone into facilities where they said, "Oh, how did you think of? What did you think about our memory care?" Because I was helping to place a patient, and I
uh-huh.
came right out and told one administrator, "Honey, you don't have memory care." I said, "You have your this true story. This worker was the cleaning guy was sitting having his lunch with a little old lady who was had dementia who was left at the table after everybody was done eating. The aides were out. There were only a few aides. Patients were not getting treatment. They were not getting interactions. It was awful.
Wow.
Things were able to come off the walls, and I thought, nope, this is not dementia care.
Yeah, that would be tough. That would be tough.
Yeah.
It goes back to a story I had when one the client says that her loved one was in a place and they had toothpicks on the table.
Oh dear God.
Yeah, toothpicks. And I was like, "Oh, you've got it. This is a joke, right?" She says, "No." And she said, I hurried up and got my loved one out of there because that didn't even make sense. Like you know, it doesn't take a genius to know
No,
certain, like you talk about things
I,
on the
I I've
wall.
had I've
Yeah.
had several situations. I actually toured another one where the kitchen was open and the residents could walk into the kitchen. There's knives and hot stuff and oh,
My gosh, that's so
it just and then you should have everything locked or hung up on the wall should be stuck there. It shouldn't be able to be moved. And I saw pictures were able to be pulled off and I'm thinking, "Oh my, it's just oh,
What
you
would you
really
say
have
to
to."
that?
Yeah, I do have on my website in my resources what to look for in assisted living so that you know that you have a good one. But my suggestion to anybody that puts a loved one in assisted living, you're paying big bucks. You've got to be there every day to check on them. You have to make good communications with the administrator. You got to be the squeaky wheel squeaky wheel if something goes wrong. So make the administrator your friend so that you can get things done in a timely fashion.
And with that said, Diane, what do you say to, so what do you, when you go into a facility and you see these things, what do you tell a family to look for? I know you said you have it on your website, but what is just maybe two things that you would say? Because I'll tell you what mine is.
Okay.
I
Okay.
walk into a facility and I've done some unannounced visits too, where we just show up to see, right? Because we do on the solution side, we do the resource and referrals, right? Because one
Yeah.
thing for us, like we was just talking about, we have families where at that point we hear it all because they're taking them out of these facilities and now they want to take them home. And
Yes.
they're telling us about the stories and why they're taking them out the facility. So we hear some of the horror stories. And so one of the things I'm like, okay, well, what would you look for as you're trying to put your loved one in one of these places? First of all, when I walk through the front door, I want to feel that, I don't know if if you're like this, but there's a feeling you get where I could live here myself.
Yes.
That's, and so, or, you have an administrator who knows everybody that's in there, the
Yeah.
residents by name, and they
Yeah.
smile when they see that person, right? To
Absolutely.
me speaks volumes on what's done. Not sure what's exactly going on up in here, but that tells me that something. It's that you get in that gut, right? In that gut that you say, I could live here if I would needed to be there. And then some places you walk in, you be like, nah.
Well, I have been in many, many different ones. The very positive, posh, upscale ones,
Right.
and some of the actually. I was in Fountain Valley, California, 12 years ago, and worked. I did a consulting position for a Medicaid or Medi-Cal run assisted living facility.
Mm.
And they all have the same problems, whether they're upscale or they're just very low socioeconomic level.
Mm-hmm.
And patients care about the food. So and the residents care about the food, and that's a big thing. So I tell people, when you're touring,
Uh-huh.
ask to have a meal. It's okay, and see what people are eating. And that's really important. But the other thing I do is I recommend that you take 2 or 3 visits to a facility unannounced, because you just want to walk through the building. You
Mm-hmm.
want to see the interaction. Nothing makes me crazier than when I see residents wandering and doing nothing, or sitting at the nurse's station or whatever, and there's no activities going on.
Right.
And that's a hard one. And I want to know how how do they handle behaviors, the challenging behaviors. So especially if it's dementia. But I think the biggest one of all is the food is really important.
Uh-huh.
And the unannounced unannounced visits will let you see at different times of the day and evening, will give you a chance to see how the staff is interacting with the clients, the patients, as well as and the family members. That's key to everything.
Right, right. It is. Well, you've summed it up. Because I was going to add, that was my next question, but you answered it already. So you said, I was going to say, give me one thing every caregiver should know. You kind of answered it already, Miss Diane.
Well, there's so many things I want to tell caregivers they need to know.
Right. But that's why they can show, that's why the next thing is going to be, you're going to share with them how they can find your information and all that good
Yeah.
stuff. But before we go, the
Uh-huh.
last thing is, what keeps you passionate about this work?
Oh, there's so much.
Uh,
I'm 72. I've been a nurse for 50 some years. And I have to tell you, um, there's so much need out there. There's so much pain. And I find that family caregivers are expected to provide care once provided by healthcare professionals. And it's just thrown at them. They're like deer in headlights. So in that way, in that sense, I think it's really important that I feel like I have to um, support family caregivers, because I want to be there for them, and I want to help them, because I fear for them right now, because the stress is so chronic, and it's so high for so long, and it's negatively impacting. The majority of caregivers spend 26% of their salaries, if they're working, on providing care for another person. Many of them end up homeless, or living at poverty level after. So I'm here to empower caregivers,
yes.
educate them, and support them any way I can.
Oh my God, that is so huge. Oh my gosh, Diane, that is so, oh my gosh. Yeah, it is yeah, because you hear it all and you see it all, and it's just not, I'm hoping it gets better, but I just don't know. And I know that as people age in place,
Yes.
as we talk about 10, 11,000 people turn 65 every single day. People are living longer. And I just wonder where we're going when it comes to caretaking. Because
Well,
there's such a shortage sometimes, or good people out there.
we are actually living in a public health crisis right now. We have more people living longer, more with chronic illness,
Hmm.
and we have a shortage of youth in our world. It's global. It's a global problem. The low birth rates has caused us to have more seniors than youth for the first time ever. And the direct care workers there's a massive shortage of them because they're treated badly, not paid well. And we're in a dire situation. And you have to know that families are the backbone of our long-term care system. And they need more than lip service. We need to provide them with real tools, real support, and a community that lifts them up. And that's why I have caregiver relief. And that's why I keep writing, speaking, teaching, and building these resources. And the road's hard, because every caregiver matters, and no one should have to do this alone.
You said it. And that's why we all, and I think for myself, for you, and just having to just share information out here to tell people that they're not alone, that there's information out here and resources that can help you just make life just a little bit easier with navigating the system.
And remember, no one can or should do this journey alone.
Exactly.
It's not possible.
Oh my gosh, that's a word. That is a word. So
Yes.
Where can people find you and follow your work, Miss Diane?
They can find me at caregiverrelief.com. They can text. I have a frequently asked questions section there, and I have an Ask the Expert. So you can go on my site and ask some questions, and I will get them to our experts. If it's something that I can answer, I will answer right away. And if you need me, just find me you can find me at Diane, Diane, at caregiverrelief.com.
Wow, you heard it right here on the Medical Equipment World and Healthcare Get the Scoop. We've had Miss Diane Carbo, a registered nurse, and all things DME, dementia, and all the things above. And we have enjoyed listening to you today, Diane. Thank you so much for what you do. May God give you continued strength to continue to do this great work that you've been doing over these 50 years. And I know that we'll be talking more and sharing information and resources and anyone we can help out there. And so I'm glad that you were able to join us on today.
Oh, well, thank you for having me. I appreciate it, Tara.
All right. So as always, you guys, we will see you on the next episode. We're wrapping up here with Diane Carbo. Thank you, Miss Diane. We'll talk soon.
Thank you so much, Tara.
Bye-bye.